Hello, everybody. Can everybody hear me? Good afternoon. My name is Denise Mananis, and I am the Senior Director of External and Business Affairs at St. John's. And I would like to thank you all for joining us for our very first ever virtual community education webinar. First, I'd like to thank our IT staff and my marketing team for such a great job in setting up these virtual programs. This is all new territory for us. And I'd also like to now welcome a few special guests who are with us today. Sally Pinto, who is from the Yonkers NNORC, which is the Neighborhood Naturally Occurring Retirement Community, which is under the umbrella of the Yonkers Office for the Aging and the WJCS, Westchester Jewish Community Services. NNORC provides programs, activities, and services, including nurse and resource specialists to seniors 60 plus living in Northeast Yonkers. And also another special guest is Z. Baird, who is from the Yonkers Public Library, which has 3 locations in Yonkers: Riverfront, the Will Library, and Crestwood. Please visit their website online for hours of service, their free programs, downloadable books, streaming movies, and more at www.ypl.org. And now it gives me great pleasure to introduce Dr. Paul Sasso. Dr. Sasso serves as the site director of the emergency department at this campus of St. John's, which is known as the Andrus Pavilion. And Dr. Sasso was also part of our incredible leadership team that led St. John's response to the COVID crisis. So without further delay, I'd like to turn it over to Dr. Sasso. Hold on, we're having a little technical difficulty. Can we get Dr. Sasso's mic back on?
All right, how about now? Fantastic. Okay. Thank you, Denise, and thank you for everyone who helped to put this together, and thank you to everyone joining us today. So as Denise said, my name is Dr. Paul Sasso. I'm the site director at the Andrus Pavilion here at the wonderful St. John's Riverside Hospital. And today I'm going to be talking a little bit about COVID, and we're going to touch upon a little bit about what our community went through, what we've done here at our hospital for our community, and kind of what we're doing as far as next steps, kind of getting ready. And what we'll do at the end is we'll kind of leave some time for some questions and answers kind of moving forward. So 2020, what a crazy year this has been. So early 2020, the world began seeing the beginning of this COVID pandemic. So SARS-CoV-2 virus, or the Severe Acute Respiratory Syndrome Coronavirus 2, commonly referred to as COVID or coronavirus. In early February of the year, we began to see the beginning of this virus affecting the United States. And in March and April, the virus exponentially exploded into our area, and Yonkers was the hardest hit community in all of Westchester and one of the hardest hit in New York. St. John's Riverside Hospital was at the forefront of this battle, and it was unlike anything that us or really any hospital has ever seen before. But we were fortunate here. We really had an amazing leadership team at this hospital. And very quickly during the early stages of this pandemic, we were able to expand our capabilities at this hospital. And we more than quadrupled the capabilities of our intensive care units. We more than doubled the number of inpatient beds. And we're able to provide very quick and efficient outdoor screening for our lower risk patients coming into the emergency department. What this allowed us to do was several things. It allowed us to save space inside the hospital for our more critical patients. And throughout the course of this battle with COVID, all levels of our hospital rallied behind this one uniform cause to kind of combat this unprecedented event. It was unlike anything that we've ever really seen before. It truly was all hands on deck. We were meeting several times a day, 7 days a week, with this one goal to ensure that our community would have access to the highest level of healthcare, that we were going to be able to provide them with the medical equipment necessary and treatments necessary to face this pandemic, and at the same time working to be able to provide all our frontline providers with the personal protective equipment for those taking care of patients directly. At the same time that all of this was going on, we also learned another very valuable lesson. We really learned how truly amazing our community is. From the outpouring of support of food and donations and thoughts of prayers, we couldn't have gotten through this as providers in a hospital system without the support of this community. So as I mentioned before, this pandemic was unlike anything that we've seen before. This was a novel virus. It's a virus that's never before made its way, as far as we know, into the human population. And we were learning about it daily. And every day, day to day, week to week, we had to make really quick decisions as far as changing the way that we were managing it and treating it. And a lot of things that we were deciding were happening at such a rapid pace. Our hospital began to enroll very early on in cutting edge treatment protocols. And as of today, we've been able to safely discharge over 700 patients home who've been diagnosed with COVID. Our commitment to the community never faltered, and in fact, the strength and dedication to our community was never before demonstrated as much as it was by this hospital during these trying times. After we kind of got through those first 2 months here in New York, and specifically in Yonkers, our hospital has remained committed and dedicated to battling this new viruses and really preparing for whatever is to come next. And that's really what I'd like to take a few minutes now to talk to everyone about. What we're doing now, and then how we're preparing for what's to come. So one of the items that we identified pretty early on in this process was the need for dedicated screening processes to identify people coming in and out of the hospitals, both patients and family members and staff, to help us to identify anyone that might be contagious or sick. What this allowed us to do was to keep the inflow of patients into the hospital and identify sick ones, and then it allowed us to properly triage those who were sick and isolate them appropriately as they came into our emergency department. We've also expanded the ways in which our community can access us. Aside from the traditional methods of driving in and coming into the emergency department and medical visits, we've incorporated a variety of telehealth practices into many of the services that are offered by our hospital. We now offer telehealth visits in our outpatient clinics, as well as telehealth visits for our virtual urgent care. We now also offer outpatient COVID screening through our virtual urgent care for all the needs of our community, whether you need a screening test to return to work, return to school, for travel, or even using our virtual urgent care if you have kind of mild symptoms just to get tested. We continue to enroll patients to this day in large clinical trials, which enables us to provide up-to-date treatments for COVID as well. So one of the things that's really been incredibly interesting is in learning how to battle this new virus and how quickly information changes. Our hospital has been at the forefront of all these changes. The medications and treatment methods that we're using now are really different than what we knew about how to treat the virus when it first showed up in February and March of this year. So just to talk about some of the things that we're doing a little bit differently. So currently in our sicker patients, we use steroid treatments, such as the medication that you might have heard about on TV and the news, dexamethasone. What this medication does is it allows us to help control the inflammatory phase when the body's immune response is reacting to the virus and help to decrease this inflammatory phase in some of our sicker patients. We currently enroll our patients in clinical trials that allows us to give patients convalescent plasma. What convalescent plasma is, it's a component of blood that's obtained from patients who've been affected with coronavirus, whose bodies have developed antibodies to coronavirus. We are then giving these antibodies through convalescent plasma to our sicker patients to help give their bodies the best chance possible of fighting off the virus. We are also enrolled in clinical trials with the drug company and medication remdesivir. Now, this medication is a little bit different than the convalescent plasma. This is an antiviral medication. And what this medication does is it helps to slow down the reproduction of the virus, such that there's less of the virus kind of circulating around the body. From a respiratory point of view, we've also changed our approach over the last several months to how we manage coronavirus as well. Early on in the course of the disease, when patients would experiencing difficulty breathing, we would often have to place these patients on ventilators and intubate patients to help them with their breathing difficulty. Now we use different techniques to help patients breathe. We use treatment modalities such as BiPAP machines and CPAP machines, as well as high-flow nasal cannula to help to kind of temper patients' breathing requirements as their body tries to recover from the coronavirus. Our hospital is also at the forefront of following along with the development of all new treatment modalities and interventions that are about to come out that you might be hearing about in the news. So for medications that you're reading about in the news, such as the company Regeneron, which is located right here in our backyard in Westchester County, which is a new antibody cocktail, which may be available soon through the Emergency Use Authorization Program, as well as following all the research behind the availability of the 11 vaccine trials that are currently underway. And these trials are starting to enter their final phases, and we should soon have some of the data and usage criteria for these vaccines hopefully coming up as well. Our hospital is staying on top of every advance in treatment modality for the coronavirus such that we can provide our community with everything possible to treat it. When patients do need to be admitted to our hospital, we've created a new patient navigator program. And I'd like to take a brief moment to introduce Stephanie Aguilar to this group as well. So Stephanie's role as our navigator pilot is to help patients who are in our hospital coordinate all aspects of their care, such that upon leaving the hospital, things like obtaining their medications, having their outpatient tests and outpatient appointments made for them, following up, transportation to and from things, are all taken care of such that when patients leave our hospital, we really try to put them in the best position possible to recover and hopefully stay out of the hospital. At this point, before we get into a little bit of the question and answer segment, I'd like to take a moment to talk to you about our hospital website and where you can go to find some useful links and information, and then we can kind of get into some questions after that. So on our hospital website, if you scroll down on our first page, there's that red screen that we just saw, the COVID link page. When you click on that link, there's a tremendous amount of useful information as far as links and information about risk assessment and our programs and recovery and information about COVID. One of the really exciting things that's coming in our near future next week is going to be a Covet Hotline. Now, this is going to be a recorded hotline that's going to be able to provide our community with information about what's going on right now with COVID, updates on how there are preventative steps that you can take as an individual to prevent yourself from getting COVID, as well as to any changes that may happen. And as we've learned with this disease is that really staying on top of up-to-date information is so important to both preventing it and then knowing what to do if you should become diagnosed with the disease. In addition, on this website, there are going to be links to other programs that our patients have access to. As we mentioned before, not necessarily every visit needs to come into the emergency department or into the hospital. Obviously, if you feel like you're suffering from a life-threatening condition, please at all times, call 911 or go to your nearest ED. But if you feel like you have like an urgent care type issue, we wanted to provide our community with access to a virtual urgent care. So now on the website, you can find the call-in number for our virtual urgent care, which is a fantastic service which allows you to be virtually connected through a provider in real time and see a provider in real time to help diagnose your more minor complaints. Updated on the website are going to be more information about this service and the things that are appropriate for this. One of the most important things that we can do, all of us as patients, is really to take care of ourselves and make sure that we're doing all the preventative things to keep ourselves as healthy as possible. And the things that we can best do to prevent the complications from COVID is really be on top of the things that we have that may be preventable. Hypertension management, diabetes management, management of our weight and cholesterol, management of our asthma and potential sleep disorder problems. And we have a absolutely fantastic outpatient community of doctors that's available for you as well to really help to manage all these things that help to keep your health in the best place possible, which is probably the most important preventative thing that we can do should someone end up getting diagnosed with coronavirus. At this point, I'd be more than happy to open this up to some questions and answers to the community and all the people that have been kind enough to take some time out of the day to join us today.
Sure. So, Dr. Sasso, one of the first questions I see is, should I take the flu shot and the COVID vaccine when it becomes available?
Great question. So, flu vaccination is something that I'm incredibly passionate about. There are so many reasons that it's important for all of us to be vaccinated for the flu. First and foremost, the flu does affect and lead to the death of several tens of thousands of Americans each year. And by simply getting a flu vaccine enables us to prevent a large number of those deaths. One reason why it's incredibly important. Two, there really are very few side effects. So unless you have an absolute medical contraindication to getting the flu vaccine, it is a generally very safe vaccine to get. Three, by us getting the flu vaccine, it not only protects ourselves from getting the flu, or at least getting a less serious or less threatening variation of the flu, but it protects those around us. And if I can do something to prevent me giving the flu to my parents or grandparents or the elderly population, I feel like I'm doing my part to help our community as well. So for all these reasons, it's so important to get the flu vaccine. And absolutely, this is the time of year right now in October where we recommend getting the flu vaccine.
Dr. Sasso, the second part of that was the COVID vaccine, when it's coming out, and should people consider getting it when it's new?
Absolutely. So one of the things that's great about our country is that we have a very, very, very thorough vetting process for all new medications and all new vaccines. And the reason that the vaccines aren't out yet is because they're still undergoing the trials and research to prove that this is safe. A vaccine will not be released to the general population until we know and are confident that this is safe. So with that understanding of the process and the fact that these vaccines are still in trial, when a vaccine becomes available, that's our indication that it's been tested and is therefore safe to receive.
Okay, we have another question. I'm actually going to combine the two of them. Someone in our audience wants to know about the use of indoor pools and communal steam and saunas and whether those are safe to do.
Gotcha. So good question. You know, as we try to kind of learn how to deal with what is our new normal, I think it's important to look at each of these situations as a case-by-case situation, right? So it's very hard to comment on every pool and every indoor sauna, but what I would do is I would take the time to check out what information is being provided to you by that facility as far as what precautions they're taking. So for instance, the gym that I belong to has sent multiple emails about how many people they're letting in to minimize the total number of people in the gym. They also provide information about cleaning procedures in between, as well as what other measures they're taking to really make sure that the facilities are as safe as possible. So specifically to the gym or sauna or pool that you're talking about, talk to the gym or facility and see what they're doing, okay? Take a tour. You know, it's okay to go check out these places to make sure that the things that you're seeing that you're comfortable with. Obviously, what we know about coronavirus is this. It is a respiratory disease. It is passed usually with close contact between patients who are symptomatic through either coughing or sneezing or prolonged periods of time where you're next to a person who may be symptomatic or contagious, okay? The more that we can minimize those types of encounters is probably the best thing that we can do to minimize our chance of obtaining or catching the coronavirus at this time. So you have to kind of think of these situations in that context. So I may not be able to speak to your pool or your sauna specifically, but if your pool or sauna is taking all the measures to prevent unnecessary close contact, adhering to social distancing, mask use when appropriate, proper cleaning techniques, it's kind of providing the safest environment possible.
Thank you, Doctor. So the next question is something that's been in the news recently. In fact, I saw it yesterday as well, but someone apparently seems to have gotten COVID-19 twice. Is that real? Is that a thing?
So unfortunately, yeah, I was reading the same thing as you guys, and it does appear so. Now, why did that individual get stricken with coronavirus twice? That's the part of the story we don't know entirely. Some of the things that we do know about coronavirus are as follows. We do know that the human body is able to produce an antibody response when it becomes infected with something. As of right now, we do know that the antibodies from coronavirus are present for at least 5 to 7 months. Again, as this is a very new virus, we're learning more about these things each day. The other thing, and this is common with all viruses, and this is why you need to get a new flu vaccine every year, is that viruses mutate and change. So the coronavirus, or the strain of coronavirus that we were seeing in Europe and then in the Northeast and in California are all slightly different strains, and they kind of mutate. So why would one individual potentially get infected twice? The reasons could be maybe the immunity that was provided to them from the first infection had kind of run its course. Maybe they were infected with a slightly different strain. What we do know is this. Regardless of the possibility of getting infected a second time, we do know that regardless of whether you've had coronavirus or haven't had coronavirus, we do need to practice the same safety precautions regardless. And that is simply wearing a mask, social distancing, really good hand washing, not touching your hands and face, and avoiding large crowds of people. Regardless of whether you've had it or not, if we adhere to those very, very, very basic principles, that's the best thing that we can do to prevent getting it either once or twice.
So doctor, another question that's come in. I am a senior and live with my children and grandkids. How can I protect myself?
That's a great question. That's a great question. And those are some of the toughest situations that we kind of encounter. I'll share a little personal story on my end. So my kids right now are virtually schooling at home, and my parents and in-laws are helping out to take care of them within the house as well. What we try to do within our household is when we're indoors and in close proximity to each other, we all wear masks. Even though none of us have any symptoms, wearing the masks and trying to maintain as much social distance as we can within our home is really the best thing that we can do should one of us become infected to prevent us spreading it to someone else. The other thing, obviously, that we do is we take every sign of infection very serious these days. You know, if you rewind the clock a couple years ago, a runny nose probably wouldn't have bothered us too much. But now, should my kids have a runny nose, on that day, I probably wouldn't have my in-laws in the house or consider testing my kids to make sure that they're truly negative for the coronavirus prior to having them around my in-laws as well. Now, again, there is no perfect answer to this question. You know, every household is very different and very specific. But I think as a just overwhelming rule of thumb, the more that we wear masks, the more that we can social distance, the more that we practice good hygiene, and the more that we take ownership for even slight illnesses, just to make sure that these aren't the early signs of COVID, are really the best things that we can do to prevent giving it to each other and especially giving it to loved ones.
So, Doctor, we just got a question from another audience member. Is a universal influenza vaccine the only way to stop future pandemics of this nature? Some estimates of it have been coming in the late 2020s, but it will be a while and probably after a COVID vaccine. What preventive measures could be done in the meantime?
I'm so sorry, Denise. Can you repeat just the first part? Was that speaking to a universal flu vaccine?
Yeah, it is a universal flu vaccine the only way to stop future pandemics of this nature?
Okay. So from a purely scientific point of view, you know, there are only a small percent of viruses that exist in the world that we even know about. There are so many more viruses that exist in nature that normally don't cross over into humans. The viruses that humans have been exposed to in the past, such as the common cold or the flu from year to year, we begin to develop a sort of innate immunity or ability to fight these off. As most of the people on this call may have experienced in the past, you've gotten a common cold before, you may have even gotten the flu before, and your body's been able to fight that off. With a novel virus, with a virus that the human body has never been exposed to before, what makes it so different and so difficult is that our bodies don't have any built-up immunity to it. So it's a brand new process of our bodies, our communities, and really the world learning how to fight these off. So unfortunately, it's not as simple as one vaccine that we come up with now for a very specific virus is going to have the ability to prevent against all pandemics in the future. But the more immunity that we develop as a human race, and the more that we become immunized through the use of effective vaccines, will eventually help us to quell this specific pandemic. There's no way to predict when or where that next pandemic might come from. When a virus that normally lives within an animal population makes that jump into the human population, those things are really, really, really difficult to predict. But a flu vaccine, unfortunately, really helps specifically with the flu virus. The COVID vaccine is specifically going to help us provide, you know, our community protection against COVID, but it doesn't necessarily guarantee protection against other or different viruses.
Okay, doctor, another question. If I do contract COVID-19, does the plasma treatment help? And are there other treatments aside from that one?
Absolutely, that's such a great question. We have seen some very promising research as far as the use of convalescent plasma. As of right now, the majority of the literature that exists on the use of convalescent plasma is really in our sicker patients. So there are different phases to the acuity of COVID. For the most part, the majority of patients who do get COVID do experience a more mild disease and self-limiting disease, meaning that the virus will usually resolve on its own without the use of any medications. The majority of the medications that I touched on before and that you read on in the papers really have been shown to work and are ultimately used on and reserved for the kind of more serious cases of COVID and the sicker patients who unfortunately get sicker from COVID as well.
Okay, so this one from an audience member, is it safe to go to a large museum in New York City? They take reservations and are limiting entrance to 25% capacity.
Another good question. I think that's a very personal decision as far as kind of your comfort level with public spaces. Again, the way I've approached it is really looking into what protocols and practices they have in place. Again, if you think of everything in the context of, is everyone wearing a mask? Is everyone social distancing? Am I avoiding touching my face and eyes? And do I feel comfortable that I don't have symptoms and I'm not going to be around patients with symptoms? And can I maintain that social distance? I think it is reasonable to kind of engage in some of these activities. I think it's important to get out of your house. You know, it's really important for all of our sanity to try to live as normal lives as possible while at the same time being as safe as possible. Personally, I try to engage in more outdoor activities right now as opposed to indoor activities, but in the right settings, if I do feel that the protocols and procedures are in place that allows me to ensure that everyone around me is practicing good mask wearing and practicing good social distancing, I would feel comfortable in some of those situations.
Okay, we're going to do two more questions. The first one is, I tested positive during the surge, also positive for the antibodies. Is there a benefit to get retested for the antibodies in a few more months? If so, what are those benefits?
Okay, interesting question. You know, kind of a little bit as I was alluding to before, we do know that antibodies in general, as far as our experience with all other viruses and illnesses that we've encountered in the past, do offer a degree of protection. However, as COVID is so new, we don't know the full extent to what protection that offers. So again, even if you've been exposed to COVID and have antibodies, I would still practice all the same measures and protocols that we're advising everyone to do. Mask wearing, social distancing, avoiding large gatherings. For your own just personal knowledge, it may be interesting to know if you still have antibodies circulating in your body, yes or no. But as far as the utility of that information, meaning should I do anything differently with that information? The answer is no. You can't assume that because you may still have antibodies present in your blood, that you're at less risk from a possible second reinfection or infecting someone else should you get infected. So those same kind of basic principles do apply.
Okay, we have good questions here. Is there a difference in early symptoms that can be identified between COVID and a cold? You mentioned a runny nose, which I would typically believe is a common cold.
Welcome to what makes medicine so difficult. It's so tricky right now with COVID because it is really presenting with the entire spectrum of symptoms, from the patients that have absolutely no symptoms, from patients that might feel a little bit fatigued, to a runny nose, a sore throat, a cough, to the more classic ones, the loss of smell and taste. We've seen patients presenting with predominantly GI or stomach complaints, nausea, vomiting, diarrhea, and then the more severe kind of classic COVID symptoms, the cough and the shortness of breath. So the truth is that not all runny noses are COVID, but we don't know 100% if I could say just because you have a runny nose, it can't be COVID. So kind of as I mentioned to some of the things that we do in our household, should anyone in our household get a runny nose, obviously we're going to practice really good mask wearing. We're going to kind of prevent myself, my wife, our children from being around the higher risk members of our family, the elderly members. And if we absolutely had to be around other people, I would probably recommend testing. You know, we're lucky right now in the sense that compared to March and April, we have available testing. It's much easier to get tested. Call a virtual urgent care. You can get tested and results within a few days. And these are PCR testing, which are the highest sensitivity testings that are out there right now. So A runny nose, do you have to run to the hospital? No. If you're not around other people, can you do watchful waiting at home and see how you do? Absolutely. But if you're going to be around other people, or you live in a housing situation where maybe you can't avoid being around other people, probably this is the year to not ignore that runny nose and get tested to be safe.
And then we have this question. I seem to remember at the beginning of this pandemic, we were told the virus can stay on metal. Is this still true? And is it safe to wear jewelry?
Great question. The virus potentially can live on hard surfaces. Less and less and less do we think that the majority of these transmissions are happening from touching a surface and then contracting the virus. The majority of these transmissions are truly from respiratory contact with other patients who are contagious. Being around someone in close proximity who has it while we're not wearing masks, being around someone who's coughing or sneezing while we're not wearing masks, those are really the majority of the exposures, right? So with that being said, as far as wearing jewelry, right? If you're not going to be closer to 6 feet from people, and if the people that you're around are wearing masks, and if you're not around people who are coughing or sneezing, it's relatively safe to wear jewelry. What is the exact percentage of getting it from the jewelry that you're wearing? It's probably very small. Your higher risk situations are really going to be exposure to people without masks and close contact, not social distancing, and those large gatherings as we touched upon before.
So I just saw one question pop up, and it sort of goes with our final question, so I'm going to combine those. Is there anything that you can do to lower your chances of getting COVID-19? And then the question that the audience member asked were thoughts about taking elderberry, vitamin D, vitamins, other things like that. So that sort of goes in line with how do you lower your chances of getting COVID?
Okay. Another great question, and really I just want to thank everybody out there. These have been some fantastic questions, and it just shows how proactive our community truly is about wanting to take all the steps necessary to prevent getting it. You've probably heard this before, but first and foremost, take care of yourselves, right? Do the things that you need to do to make sure that you are the healthiest version of yourself that you can be, right? And these are simple things, and these are things that we talk about at different times of years when we're not dealing with pandemics. Get good sleep, right? Eat a healthy diet. Exercise as much as you can on a regular basis, as long as you're safe to do so. If you do have pre-existing conditions, make sure that you're addressing them. I see absolutely no downside to taking over-the-counter vitamins and minerals. But really the most important things that we can do are to make sure that our bodies are as healthy as they can be should we encounter or should we contract COVID. Again, the majority of the cases will be mild in nature, okay? Get very sick from this. It is the ones that are older and have pre-existing conditions that are at higher risk to have complications. But it doesn't mean just because you have a pre-existing condition or you're older that it's absolute that if you get COVID, you're going to end up very sick. But the better that we do of taking care of ourselves puts our bodies in the best position possible to be on the side of the population that experiences the mild disease and the self-limiting disease that doesn't require the hospitalizations and all the medications that we were talking about before.
So with that last question, I'd like to say thank you, Dr. Sasso, very much for sharing all of that wonderful information with us. And also, again, to Sally Pinto and to Z Baird, our guests today, and to all of our attendees. Thanks for being with us on our very first virtual foray out into the community. So we'll see you again. We have another one. In fact, we're going to share the information on our COVID Center hotline, which will be up next week. If you can share that, there you go. And And then we'll be sending more information out about the next events if you haven't already registered for them, and they're coming up in the next couple of weeks. One is on breast cancer awareness, one is on pain management, and one is on stroke. So that information will be out very shortly, and we look forward to seeing you there. Thanks so much.
Thank you, everybody.